Hi everyone, I am Farhana Kida, the reporter number 2 in Group 11. So in substance-related and addictive disorders, my assigned topic is cannabis-related disorders and opioid-related disorders. Cannabis are also known as marijuana-related disorders. So ang commonly used word for cannabis ay marijuana. Ang other names naman nito ay pot, hash, weed, Buddha grass, dope, ganga, herb, and reefer. Ang cannabis is isa siyang plant that it was contains tetrahydrocannabinol or THC. So itong THC is a psychoactive ingredient ng marijuana. So this ingredient makes marijuana an addictive substance. So the dried marijuana leaves are smoked. So ang THC rapidly nag-i-enter siya sa bloodstream ng lungs na nagpo-produce an immediate high. Nagpapataas siya ng level. Diagnostic criteria, cannabis use disorder, a problematic pattern of cannabis use leading to clinically significant impairment or distress, as manifested by at least two of the following. So, occurring within a 12-month period, dalawa sa symptoms nito. So number 1 is cannabis is often taken in larger amounts or over a longer period than was intended. So ito yung paggamit ng mga tao ng cannabis na larger amount siya at saka yung period is longer than was intended. So number 2, there is a persistent desire or unsuccessful efforts to cut down or control the cannabis use. So ito yung mga tao na di nila maiwasan or di nila makontrol yung paggamit nila ng cannabis. Number 3 is a great deal of time spent in activities necessary to obtain cannabis, use cannabis, or recover from its effects. 4. Craving or a strong desire or urge to use cannabis. So ito yung pag-crave ng mga taong gumagamit ng cannabis na gumamit pa nito. Number 5, recurrent cannabis use resulting in a failure to fulfill major role obligations at work, school, or home. Ito na yung mga taong gumagamit ng cannabis is dati active sila sa work nila pero after nila mag-use ng cannabis, parang hindi na nila na-fulfill yung mga obligations nila gaya sa work, sa home, or school. Number 6, continued cannabis use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of cannabis. Number 7, important social, occupational, or recreational activities are given up or reduced because of cannabis. 8, recurrent cannabis use in situations in which it is physically hazardous. Number 9, cannabis use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by cannabis. Number 10, tolerance is defined by either of the following. A, need for the markedly increased amounts of cannabis to achieve intoxication or desired effect. B, a markedly diminished effect with continued use of the same amount of cannabis. Number 10, withdrawal as manifested by either of the following. So letter A is a characteristic withdrawal syndrome for cannabis. Refer to DSM-5 for further details. So B naman is cannabis or a closely related substance is taken to relieve or avoid withdrawal symptoms. Cannabis use disorder is a specified current severity. So, mild cannabis use disorder is defined as the presence of 2 to 3 of the above symptoms. So, 2 to 3, ang makikita sa symptoms ng isang tao is mild pa siya. When it's 4 to 5 or above symptoms, moderate cannabis use disorder na yung person. And it would be severe cannabis use disorder kapag 6 or more of the above symptoms ang present sa isang tao. So, diagnostic features, cannabis use disorder and other cannabis-related disorder include problems that are associated with substances derived from the cannabis plant and chemically similar synthetic compounds. So, over time, this plant material has accumulated many names. So, sabi ko nga kanina sa introduction, cannabis has many names. So, with both herb, grass, reefer, Mary Jane, and others. Kaya cannabis is generic and perhaps the most appropriate scientific term for the psychoactive substances. So, derived from the plant as such as it is used in this manual to all to refer all forms of cannabis-like substances, including synthetic cannabinoid compounds. New to DSM-5 is the recognition that abrupt cessation of daily or near daily cannabis use often result in the onset of cannabis withdrawal syndrome. So individuals with cannabis use disorder may use cannabis throughout the day or over a period of months or years and thus may spend many hours a day under the influence. Associated features supporting diagnosis, individuals who regularly use cannabis often report that it's being used to cope with mood, sleep, pain, or other physiological or psychological problems. And those diagnosed with cannabis use disorder frequently do have concurrent other mental disorders. So, ito yung to experience euphoria or to forget about problems in response to anger as an enjoyable social activities. Yung reason nila kung bakit sila gumagamit ng cannabis. So, an important marker of symptoms use disorder diagnosis, particularly the milder cases, is continued use despite a clear risk of negative consequences to other valued activities or relationships. The risk and prognostic factors in cannabis use disorder, we have a temperamental. So it was a history of conduct disorder in childhood or adolescence, and antisocial personality disorder are risk factors for the development of many substance-related disorders, including cannabis-related disorder. So, other risk factors include externalizing or internalizing disorder during childhood or adolescence. The environmental risk and prognostic factors naman is include academic failure, tobacco smoking, unstable or abusive family situation, use of cannabis among immediate family members, a family history of a substance disorder, and low socioeconomic status. Genetic and physiological genetic influences contributes to the development of cannabis use disorder. So heritable factors could contribute between 30 and 80% of a total variance in risk of cannabis use disorder. So it should be noted that common genetic and shared environmental influences between cannabis and other types of substances use disorders, such as a common genetic basis for adolescent substance use and conduct problems. The culture-related diagnostic issues ng cannabis is probably the world's most commonly used illicit substance. So, it was occurrence of cannabis use disorder across countries is unknown, but the prevalence rates are likely similar among developed countries. Developed countries is like the United States kasi nagde-develop na sila or pinag-aaralan na nila yung marijuana. So, it is frequently among the first drugs of experimentation, often in the teens of all cultural groups in the United States. Yun nga yung sabi ko, sa United States, pinag-aaralan na nila yung marijuana na maging substance ng medications. However, sa Pilipinas, di pa siya approved kasi marami ding nagtatanom ng marijuana, nahuhuli pa rin sila because it was not approved sa Pilipinas. Sa United States lang siya. Other country. Diagnostic markers of cannabis use disorders, the biological test for cannabinoid metabolites are useful in determining if the individual has recently used cannabis. such testing is helpful in making a diagnosis, particularly in the milder cases if an individual denies using while others purport concern. So, ang expertise is in urine testing methods is needed to reliably interpret results. So, differential diagnosis is the non-problematic use of cannabis difficult to make because social, behavioral, or psychological problems. So, other mental disorders is characterized by symptoms that resemble primary mental disorders. Cannabis intoxication. So, ang diagnostic criterion nitong cannabis intoxication is yung recent use of cannabis, clinically significant problematic behavioral or psychological changes that develop during or shortly after cannabis use. Two or more of the following signs or symptoms developing within 2 hours of cannabis use, like yung conjunctival injection, yung increase ng appetite, or nagda-dry yung mga mouth nila, and the tachycardia. So, the signs and symptoms are not attributed to another medical condition and are not better explained by another mental disorder, including intoxication with another substance. Specifier naman ng cannabis intoxication is the when hallucinations occur in the absence of intact reality testing, a diagnosis of substance, medication induced psychotic disorder should be considered. So, diagnostic features. The essential feature of the cannabis intoxication is the presence of clinically significant problematic behavioral or psychological changes that develop during or shortly after cannabis use. My second topic is about opioid-related disorders. So, what is an opioid? So, ang opioid ay natural and semi-synthetic or synthetic chemicals that interact with opioid receptors in the body and brain and reduce perception of pain. Ito yung mga capsules na nagre-reduce siya ng pain na nararamdaman ng isang tao. While ang opiates is sometimes ito yung from poppy plant, such as heroin or morphine. Ito, ang opioids naman is natural or derived in the lab or gawa siya sa lab. Ganun siya. Ganun yung opioid. So, ang diagnostic criteria ng opioid disorder is yung taking larger amounts of taking drugs over a longer period than intended. Persistent desire and unsuccessful efforts to cut down or control opioid use. Yung hindi maiwasan ng tao na tigilan yung paggamit ng opioid. So, spending a great deal time of obtaining or using opioid or recovering from its effect. Number 4, craving or a strong desire to urge to use opioids and problem fulfilling obligation at work, school, or home. 6 is continued opioid use despite having recurring social or interpersonal problems. 7 is giving up or reducing activities because of opioid. Using opioids in physically hazardous situations such as driving while under the influence of opiates. Continued opioid use despite ongoing physical or psychological problems likely to have been caused or worsened by opioids. Tolerance need an increased amount of diminished effect with continued use of the same amount. 11 is experiencing withdrawal or taking opioids to relieve or avoid withdrawal symptoms. Opioid withdrawal symptoms. While opioid use disorder is similar to other substances use disorder in many respects, it has several unique features. So, opioids can lead to physical dependence within a short time. It was a short time, so 4 to 8 weeks. So, in other words, the body will become used opioids so that it is difficulty functioning without opioids. So, yung mga nag-use ng opioids, parang nahihirapan sila yung body nila nahihirapan mag-function kapag hindi sila nakakagamit ng opioids kasi nasanay na yung katawan nila na gumamit nito. So, as with other substances use disorder, both genetic factors and environmental factors such as exposure to trauma or ease of access contribute at risk of opioid disorders. So according to American Medical Association, an estimated 3% of 90% of people who take prescription pain medication develop an addiction to them. So people misusing opioids may try to switch from prescription painkillers. Ito nga yung nagsastart na yung pagiging addict nila sa opioids because there's a certain pain na gusto nilang ma-reduce or maalis, but because of opioids, parang na-addict na sila, so hindi na nila naiiwasan yun. So, ang treatment sa opioid use disorder is effective treatments are available. However, only the 1 in 4 people with opioid use disorder receive specialty treatment. So, ang opioid treatment is gold standard, which is mga may kaya or mayaman lang yung nakaka-use or gamit or nakakapag-treat ng opioids. However, the evidence-based treatment for individuals with the opioid use disorder, counseling and behavioral therapies may be important part of treatment alongside of medications. So, aside of the medications, ginagamit din yung counseling and behavioral therapies sa opioid. So, however, they are effective by themselves. So, medications are also used to relieve cravings, relieve withdrawal symptoms, and block the euphoric effects of opioids. So, the medication do not cure the disorder, but rather improve safety and prevent withdrawal symptoms, which can lead or relapse or continued drug use. So, ginagamit yung mga medications sa opioid treatment, which is not, hindi siya nag-cure, but yung para tigilan ng person na gumamit ng opioids. So, different levels of treatment. So, may different levels of treatment. Depende din ito kung ang individuals is it was outpatient or intensive, inpatient or long term. So, evidence-based care for opioid use disorder involves several components, including yung personalized diagnosis and treatment planning tailored to the individual and family. So, personalized diagnosis and treatment planning is about the individuals na gumagamit sa opioids and with the help of the family members niya. So, long-term management is addiction is chronic condition with a potential for both recovery and recurrence. Long-term outpatient care and support is important. It was also dapat FDA-approved medications and effective behavioral interventions delivered by trained professionals. Also, coordinated care for addiction and other conditions. And lastly, recovery support services such as mutual aid groups, peer support specialists, and community services. So, yun lang po. Thank you.